Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Today, more worries as confirmed COVID-19 cases hit 407, 12 deaths recorded, including a Lagos medical doctor exposed to a COVID-19 patient. Government appeals to Nigerians on wearing a face mask with requisite sanitary and hygiene practices. And Chinese doctors head to Ethiopia and Burkina Faso to assist in the coronavirus fight. The situation calls for concerted efforts from all following the rising cases of COVID-19 in the country. Current figures from the Nigeria Center for Disease Control (NCDC) shows that a total of 407 cases of COVID-19 has been recorded. The number of those discharged is 128 and 12 deaths. The breakdown of the figures showed that Lagos has 232 cases, followed by the FCT with 58, Osun 20, Kano has 16, Edo 15, followed by Oyo 11, Ogun 9, Katsina 7, Bauchi and Kaduna, also Akwa Ibom states, have 6 each, Kwara, Delta 4 cases each, Ondo 3, Enugu, Ekiti, Rivers and Niger states have 2 cases each, followed by Benue and Anambra states with 1 case. Let's go across the state in Nigeria and the various measures following the COVID-19 pandemic. We begin in Niger State, one of the states that is leaving nothing to chance as the state government turned back a trailer load of travelers from Lagos State. The secretary to the Niger State government, Mr. Ahmed Matani, said the people were stopped at Gidankwano by security operatives. Mr. Matani explained that there was no waiver for any truck not carrying food items, fuel, or other essential items to enter the state following the lockdown order there. And one of the newly designated testing centers approved by the National Center for Disease Control (NCDC), situated at the National Veterinary Research Institute (VOM) in Plateau State, is now set to receive samples that will cover parts of the northeast states of the country. Plateau State the governor, Simon Lalong, after inspecting the biosafety level 3 laboratory, which can handle up to 1,000 suspected COVID-19 cases, told journalists on the need to utilizing available establishments that could be useful in addressing the pandemic, and the research institute is one of such that will serve the people of that area. Now, in Kaduna State, they are pooling resources together to ensure that their vulnerable Kingsmen and women are taken care of during the current coronavirus lockdown. With no date when the lockdown will be relaxed, many communities in the northwestern state have donated relief materials to the people in order to reduce the chances of contracting the virus. They're also calling on both states and federal government to assist indigent and vulnerable Nigerians with special funds in order to cushion the effect of the lockdown. In Yobe State, the Victim Support Fund Task Force on COVID-19 has donated food items and medical consumables with worth 65 million naira to IDPs and other vulnerable persons in Yobe. Presenting the items to the government, the VSF team leader says the intervention is strategically to provide palliative to 2,500 households, consisting of 10,000 individuals in the state. Now, Anambra State has recorded a death not as a result of COVID-19, but a result of the lockdown enforcement in the state. Joint security team in Onitsha, the story broke of the shooting of a 20-year-old man allegedly by another police patrol team on routine operation at New Tire Axis, Idemili North local government area of the state. According to eyewitnesses, he was shot inside his street by police officers who came to enforce the lockdown. But according to the Anambra State Commissioner of Police, Mr. John Abang, his men suddenly came under an unprovoked attack by a group of miscreants. It was also another tragedy as one person was shot during a protest by residents of Sapele against the extension of the lockdown by the state government by another 14 days. The State Commissioner of Police claims hoodlums took advantage of the protest, which became violent after the protest began, but assures that arrests have been made, investigations have begun in that state. To Akwa Ibom, where 3 of the initial 5 index cases of COVID-19 have been discharged from the Ibom Specialist Hospital in Uyo State. The State Commissioner for Health, Dr. Dominic Upong, who disclosed this, said that 3 other suspected contacts who were traced and isolated and whose tests have equally come out negative have also been discharged. Let's go over to Enugu State, where the government has discharged a COVID-19 patient from the treatment and isolation center. The State's Ministry of Health said the other patient is stable and responding well to treatment. This is just a few of the states there and what they're doing in the wake of the pandemic. Now, the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Chikwe Hekwazu, is concerned about how the country will return to the pre-COVID-19 era. Now, speaking today on our breakfast program, Sunrise Daily, he said the whole idea of efforts made by the Presidential Task Force on COVID-19 is to ensure that this virus is properly managed to allow businesses reopen as soon as possible.
This is just to let everyone know that we are not anticipating that in the next 10 days we will get to 0. We are anticipating that we will have a public health response that can work while slowly people start going about their small businesses. I don't anticipate a situation where everything will be open and, schools will open, markets will open, airports will reopen on the same day. No. I think there will be a gradual increase, a very carefully calibrated reopening of the economy, and certain things, our behaviors in shops, in schools, some of the social distancing that we have introduced. Every business right now should be preparing, thinking, how do I run my business differently? How do I run my restaurant differently? How do I organize my school and teaching differently in the context of COVID-19? So there will be a new COVID-19 era that will not be the same as the pre-COVID-19. And I really encourage every small business, every community to be thinking about this, because at some point, Mr. President will have to reopen the country slowly. And people have to, at the same time, we have to keep trying to prevent transmission. So we have to find a middle path between a lockdown country and one that is able to respond to the big public health challenge that we have facing us.
Well, let's talk about this. Joining us for more on the measures to curb the spread of COVID-19 is Dr. Adenike Oguntuashe, a medical officer of health, Koshofe local government area here in Lagos. Thank you for joining us on the program.
Thank you for inviting me.
I'd like to start by asking what the NCDC DG said, looking at a pre-COVID-19 era. He said it won't be like before, but essentially looking at operating in the midst of a pandemic. Is that possible?
It's possible, but I believe we should continue the lockdown for a certain period of time to limit the transmission. Because by the time people start moving from place to place, even during the lockdown, people have not kept to the rules. People are still moving up and down. And that explains for the rise in transmission as well. So if you lock down and people are moving up and down, by the time you now tell them there's a measure in place that you should limit your movement, you should limit this, people that have not obeyed the lockdown rules will not still obey. So I believe the lockdown should be extended for a while, for Nigerians to know there's really a problem and to now be able to achieve any stringent measures we want to put in place.
When you say a while, what would you advise, other than this second phase of 14 days that we have?
Other than this second phase of 14 days, maybe another month.
That's very interesting. You've been a very active contact tracer in Lagos. Tell us your experience.
Okay, in Lagos State, we first of all started with contact tracing when we had travelers from abroad importing the disease into the country. So at that time, anybody that comes in, they take their immediate address wherever they will go, initially from the airport. Then their main address, that's the main destination where they are going. And we follow them up for 14 days. go to their home, give them a form, they fill the form. I'll monitor their temperature daily, morning and evening, through the phone. And at the end of the 14th day, we issue them another form as that they are free. Then we monitor if they now develop symptoms in the course of these 14 days. We take their samples, and if they become positive, we line list all their contacts at the point of taking sample, because we had realized that after taking samples and patients become positive, they are not as cooperative as they were initially.
What does that mean?
They don't want to give information about their contacts, all of the contacts. But at the point of taking the sample, when the patient is still anxious about his or her clinical state and their status to know if they are positive or negative, they are ready to divulge more information and tell us more of their contacts. So at the point of sample taking, we line list all the contacts with their phone numbers and home address, such that if the patient become positive, we will now be able to call those contacts and monitor them as well, using temperature reading, symptoms like cough, sore throat, fever, difficulty in breathing, diarrhea. So we will now know if they come up with any symptoms so that they too can be sampled. That was before. But now, because we have noticed that there's about 18% community transmission within the state, we started active case search, whereby an active surveillance. Active case search, we visit all our private facility. Normally all the private facility reports to the Office of the Medical Officer of Health, monthly data entry for all the services they render. So we have the list of private facility in our office. So we have made a roster for them to visit different private facility on each day, and we go through their registers to check for likely patients that presented with symptoms of cough, with fever, sore throat, with fever, unexplained breathlessness, or difficulty in breathing. So we line list all these clients. We call them clients, not patients anymore. We line list all of them and give them a call. Initially was to give them a call to know if they were getting well, but we realized that we weren't testing enough people. So we give them a call to move to a designated sample collection site in each local government. Now in Lagos State, every local government have a sample collection site, at least one, some depending on the volume of clients they have.
And I'm sure that in these cases, there have been some positive cases in this active case search. It's also is that why we're having more cases in Lagos? And I also want to ask you about the death of the medical doctor, because we're hearing that he wasn't put on a ventilator.
Okay, we have more positive cases because we are doing more search. Because apart from the active case search, we also have community surveillance, whereby we are going from door to door, asking people for those symptoms, and also the set of people that are suspected with the symptoms of COVID-19 are sent to the sampling site. And the death of the doctor was asthmatic. So it's not just COVID-19 symptoms alone. And I wasn't involved in the treatment, so I cannot say if he was put on the ventilator or not. But he was asthmatic. That is an underlying factor that will worsen the case. For everybody, if you are above 50 years of age or you have an underlying disease, it will worsen the prognosis of the person that has COVID-19. So anybody with any disease, and asthma is a respiratory disease on its own. COVID-19 is another respiratory disease. So adding them together, the synapse that happen with it will increase the likelihood of death or fatality in that patient.
Sadly, but we would like to appreciate your time on the program, Dr. Adenike Oguntuwashi, Medical Officer of Health, the frontline Medical Officer of Health, Koshofe local government area. Thank you for joining us.
Thank you.
So to come on the COVID-19 update, is poor database and inadequate testing centers responsible for poor contact tracing among over 200 million population of Nigeria? Find out who's saying this and why when we return. Welcome back. A COVID-19 Economic Recovery Committee has been inaugurated by the Bauchi State Governor Bala Mohammed. The task is to ensure fiscal sustainability and development during the post-COVID-19. The committee, which is chaired by the Commissioner of Budget and Economic Planning, Dr. Aminu Gamawa, has 2 weeks to submit its report. In the meantime, Governor Mohammed has cleared the air over the controversy surrounding the deduction of workers' salaries to fight COVID-19.
It is with gratitude to terms of reference of the committee are as follows: to identify clearly alternative source of funds for the state that will augment the current revenue sources. 2, to suggest ways of developing economic growth measures that will sustain the state during and after the COVID-19 crisis. 3, to make any other useful recommendation incidental to the assignment. 4, to co-opt any person or persons that will be instrumental to the committee's assignment, that is the achievement of the committee's assignment. At this juncture, I would like to express my appreciation to the State Civil Service who have agreed to donate certain percentages of their salaries to fight against COVID in both states. Let me add that the donation from individuals and civil servants should be at will and should be voluntary. I have had some murmurs, some dissensions from some quarters of the public service. I have therefore directed the Deputy Governor and the Accountant General that all deductions from the salaries of the civil servants should be withdrawn with immediate effect. Anybody who wants to contribute, you have opened an account, he should voluntarily do that.
A professor of hematology at the Olabisi Onabanjo University, Agoiwoye, and also president of the College of Nigerian Pathologists, Professor Philip Olatunji, has identified poor database, inadequate testing centers in the country as responsible for poor contact tracing. He said this in the Ogun State capital, Abeokuta, while addressing journalists on coronavirus pandemic, which has continued to take its toll on the socio-economic development of the country.
This will not be the last pandemic. Another will come. We must be prepared. Our public health infrastructure, our laboratories, and our healthcare workforce must be rebuilt so that the weakest among us has access to good healthcare. It is equally necessary to mention our poor national database, this which has made contact tracing a serious problem. We, however, want to praise the ingenuity and hard work of those who have found ways around the many challenges this has posed to reach the many contacts. Funds must also be made available for surveillance, contact tracing, and post-treatment follow-up of patients treated and discharged. We have the view that contact tracing should be localized and brought to the level of state and local governments. Surveillance offices at state and local government levels should be empowered to take up such responsibilities in their localities for promptness and ease of logistics through information from NCDC. Antiseptic solutions, cleaning solutions, and basic personal protective equipment should not be economized because the lives of those caring for patients depend on them. Masks, disposable aprons, and gloves cannot be too much. Medical masks should be reserved for patients and health workers that are looking after them.
Let's go over now to Bayelsa State, where our correspondent Dobra Timiwood has this update.
A couple of weeks earlier, there was noticeable reduction in vehicular movements. Now, entrepreneurs had to close their shops. Roadside vendors like this were nowhere to be found. But today, we're noticing that people have begun opening up their shops. Roadside vendors are back on the streets, asking the public to patronize them. Now, we've also discovered that there's a large reduction in the usage of hand gloves and face masks. Now, we've also discovered that there's a hike in prices as vendors are saying due to the closure of the borders, they have to hike their prices, and now that is causing untold hardship on Bayelsans. At the market in Bayelsa State, there's also a partial closure. People not selling food items and medical supplies have been advised to stay at home. Civil servants from level 1 to 12 have also been directed to stay at home. Aside those staying at home, those that earn their daily living by trading every day are out on the street, calling on people to patronize them to ensure that they have money to feed themselves and their families. From Yenagoa, Dobra, Simiwood.
Now, China is sending more medical teams to Africa to support its battle to combat the spread of the coronavirus. The number of infections on the continent has risen past 17,000 with over 900 deaths. Meanwhile, the total number of coronavirus cases in the world has surpassed 2 million and more than 137,000 people have died, majority of them in the United States. And according to the Nigeria Center for Disease Control, NCDC, current evidence shows that about 80% of COVID-19 patients experience mild symptoms and recover. Recommends the treatment of every positive case in an isolation center to mitigate the risk of spread. The website has all the information and statistics on the cases across the states. You can also access emergency contacts if you need to. The World Health Organization's website has rolling updates on the pandemic, the World Health Body's strategies and plans on the coronavirus, and each moment it keeps updating on the number of cases and also the number of deaths. Well, that's our COVID-19 update on Channels Television. Thank you for watching. Another update comes up at 6 p.m. In the meantime, we'd like to hear from you. Tweet at us as you social distance and stay at home at Channels TV. I'm Millicent Walker. Bye for now.